You can train for a 1OK, finish it strong, have no symptoms at all, feel completely healthy, while a deadly blockage known as a Widowmaker is silently developing inside your chest. How's that even possible? It happens because biology does not care how fit you look on the outside or how fast you can run. The human body is incredibly skilled at adapting to stress and change. It can adjust so well that it hides a 90% blockage in a major heart artery, keeping blood moving well enough that you notice nothing, right up until the exact moment it can no longer compensate. This is why, for nearly half of all men, the very first sign of heart disease is not chest pain or shortness of breath. It is sudden death. There's no warning shot. In this video, I am going to explain why a heart that seems strong and healthy can suddenly fail, how your body conceals these dangerous blockages for years, and what you can actually do to check your heart before it is too late. The goal is to understand what is happening beneath the surface, because feeling fine does not always mean you are safe. Many people assume that serious heart disease must come with obvious symptoms. The truth is that the absence of symptoms can be the most dangerous stage of all. If you rely only on how you feel, you may miss the critical window when action could prevent a catastrophic event. To understand why a heart that seems healthy can suddenly fail, we need to look beneath the chest wall and examine how it is built. When you study the heart's anatomy, you see a powerful muscle that requires more oxygen than almost any other tissue in the body. It works non-stop every second of your life, so its need for a steady oxygen supply is enormous. To meet that demand, the heart depends on a network of blood vessels that wrap around its surface. These vessels are called the coronary arteries. Early anatomists believed this network resembled a crown sitting on top of the heart, which is where the word coronary comes from. But instead of picturing a crown, imagine the roots of a massive tree. If a single small root is damaged, only a tiny branch suffers. But if a major root is cut off, the entire tree can collapse almost immediately. The heart has two main coronary arteries, the right coronary artery and the left coronary artery. The left one quickly divides into a large and critical branch called the left anterior descending artery, often shortened to the LAD. In emergency medicine, this vessel has earned a dark nickname, the Widowmaker. The reason is simple and based on structure. The LAD supplies blood to the front and lower portions of the left ventricle, which is the heart's main pumping chamber. If a small side branch becomes blocked, only a small area of heart muscle is affected. But if the main trunk of the LAD is blocked, the heart can lose its ability to pump blood to the entire body, causing rapid and massive damage. But how does a serious blockage develop in someone who works out regularly and appears healthy? To answer that, we need to focus on the wall of the artery itself. A healthy artery is flexible and smooth, similar to a brand new rubber garden hose that bends easily and allows water to pass through without resistance. The inner lining of the artery is called the tunica intima. In ideal conditions, this lining is extremely smooth, almost like a non-stick surface, allowing blood cells to flow past without friction or disturbance. However, real life is not perfect. Over many years, certain factors begin to damage that smooth surface. High blood pressure presses forcefully against the artery walls. High blood sugar creates chemical stress. Smoking introduces toxins that irritate and inflame the lining. Even the repeated mechanical strain from decades of high-volume blood flow during intense exercise can cause tiny, microscopic injuries. These small scratches and tears may be invisible, but they are where the problem begins. The body tries to repair these damaged spots. It sends LDL cholesterol to patch the injured areas. Much like filler used to fix a crack in a wall, then the immune system sends white blood cells to inspect the site. These cells absorb the cholesterol, transform into what are known as foam cells, and gradually accumulate. Over time, this mixture of cholesterol, immune cells, calcium, and debris hardens. That hardened buildup is called plaque, and the overall disease process is known as atherosclerosis. Now here is the dangerous misunderstanding that leads many people to underestimate their risk. Most imagine plaque building up inside an artery the way hair clogs a drain. They picture the passageway slowly getting narrower and narrower until one day it finally closes off completely. Based on that idea, they assume they would feel warning signs as the space shrinks. They expect shortness of breath, chest discomfort, or declining exercise ability as the blockage progresses. That line of thinking seems logical, but it does not match how the body actually behaves. Human body is remarkably adaptable. As plaque accumulates inside the artery wall, the vessel does not simply narrow inward. Instead, the outer wall of the artery can stretch and expand outward to make room for the growing plaque. This process is called positive remodeling, because the artery enlarges outward. The inner channel where blood flows can remain almost completely open for years. Blood flow appears normal. Oxygen delivery appears normal. You may have no symptoms at all. You can run at 10,000 and feel strong because blood is still reaching the heart muscle. This is why, for roughly half of men and nearly 2/3 of women, the first sign of heart disease is sudden death. They feel completely fine until the moment the system suddenly fails without warning. There is also another situation that often affects endurance athletes who push their bodies to the limit. This is called a type 2 myocardial infarction. Imagine a disciplined 50-year-old runner named Robert. His cholesterol numbers are normal and he trains consistently. During a race, he does not feel the dramatic, crushing chest pain people associate with heart attacks. Instead, something just feels off. His energy suddenly drops. He becomes lightheaded and slightly nauseated. He assumes he is dehydrated or simply overexerted. When he arrives at the hospital, doctors run blood tests and find a protein called troponin circulating in his bloodstream. Think of troponin like the fluid inside a glow stick. As long as the outer casing remains intact, the liquid stays contained. But once the casing breaks, the fluid leaks out. Heart muscle cells are packed with troponin. When those cells are injured or die, they rupture and release troponin into the blood. That is how doctors confirm a heart attack. Yet when physicians examine Robert's arteries, they do not find a completely blocked vessel. They find a 50% narrowing. So how did he suffer a heart attack if blood was still flowing? The answer is a mismatch between supply and demand. While resting, a 50% blockage may not matter. But when Robert's heart rate surges to 170 beats per minute, his heart demands a massive increase in oxygen-rich blood. The partially narrowed artery simply cannot deliver enough. The heart muscle begins to suffocate. In Robert's case, there was an additional complication: atrial fibrillation, often called AFib. The heart operates on a carefully timed electrical system that coordinates each beat into a strong, organized squeeze. In atrial fibrillation, the upper chambers stop contracting normally and begin to quiver in a chaotic pattern. This disrupts timing and reduces efficiency. When you combine a partially narrowed artery with the rapid, irregular heartbeat of a fib, you create a dangerous situation. The heart is beating so quickly that it has less time to fill with blood between beats, and the already narrowed arteries cannot deliver enough oxygen to match the increased workload. This leads to further strain on the heart muscle. This situation also helps explain the 70% rule. In general, most people do not experience classic chest pain until an artery is about 70% blocked. Below that level, the heart can often compensate. Above that level, you may begin to feel tightness or pressure during physical activity that improves with rest. This pattern is known as stable angina, and it functions like a warning signal from your body. However, most heart attacks actually occur in arteries that are less than 50% blocked, because softer plaques are more likely to rupture than large stable ones. If you cannot reliably feel a blockage developing, is there any encouraging news? There is. The heart has a built-in backup system known as collateral circulation. Think of your major coronary arteries as large highways. If traffic builds up slowly over many years, the heart can gradually construct smaller side roads to route blood around the obstruction. These alternate pathways can partially compensate for a blocked artery. This is one reason a 70-year-old might survive a heart attack that would be fatal for a 40-year-old. The older heart may have had decades to form these natural bypass routes. In a younger person, a sudden rupture can shut down a major vessel without warning, and there may be no alternate path ready to carry the blood. One of the most effective ways to stimulate the growth of these collateral vessels is structured exercise. It's particularly Zone 2 training and high-intensity interval training. Regular cardiovascular training encourages the development of this network, which can provide critical extra time during an emergency. In emergency medicine, there's a simple phrase: time is muscle. After about 20 minutes without blood flow, permanent damage begins. After 90 minutes, heart muscle can turn into scar tissue, and scar tissue does not contract. To preserve heart muscle, you must recognize symptoms quickly. Men often experience the classic presentation of chest pressure and arm pain. Women may experience extreme fatigue, shortness of breath, or even severe indigestion-like discomfort. A sudden sense of dread should never be ignored. When the plumbing of the heart fails, cardiologists move quickly to restore blood flow. The most common emergency procedure is called percutaneous coronary intervention, or PCI. During this procedure, a specialist threads a thin tube through an artery in the wrist or groin and guides it up to the heart. Using contrast dye and imaging, they locate the exact site of the blockage. Once identified, a tiny balloon at the tip of the catheter is inflated to press the plaque against the artery wall and reopen the channel. After that, a stent is placed. A stent is a small metal mesh scaffold that expands and locks into position, holding the artery open long-term to keep blood flowing. But emergency treatment is not the same as prevention. The real goal is to identify dangerous plaque before it causes a crisis. Standard blood tests can show cholesterol levels and other risk markers, but they only reveal what is circulating in the bloodstream. They do not show whether those particles have already embedded themselves in the artery walls. To truly assess risk, imaging provides stronger answers. A coronary artery calcium score, or CAC scan, is a quick scan that detects hardened calcium deposits inside the arteries. Score of 0 is ideal. A score above 400 signals very high risk. A CT angiogram goes even further by visualizing soft plaque that is not yet hardened. This type of scan can detect unstable plaques before they rupture. A heart attack in someone who feels healthy is often a failure of awareness. Control blood pressure to reduce mechanical damage to arteries, manage blood sugar to limit inflammation, stay physically active. Do not rely on guesswork about your health. Use available tools and know your true risk. The healthy heart attack is almost always a tragedy rooted in not knowing what is happening beneath the surface. Many people assume that if they exercise, eat reasonably well, and feel strong, they are protected. But silent plaque can still develop for years without obvious warning signs. That is why prevention must be intentional. Control your blood pressure, because constant high pressure acts like repeated stress on the artery walls, increasing the chance of microscopic damage. Manage your blood sugar carefully, since elevated glucose levels promote inflammation and make plaque more unstable. Avoid smoking and limit exposure to factors that irritate the lining of your arteries. Keep moving consistently, because regular physical activity supports healthy vessel function and encourages protective adaptations. Do not assume that feeling fine equals being safe. Modern medicine has powerful tools that allow you to look directly at your arteries instead of guessing. A calcium score can reveal hardened plaque. Advanced imaging can detect softer, unstable plaque before it becomes a crisis. The point is not to live in fear. The point is to replace uncertainty with data. When you understand your actual risk, you can act early and prevent irreversible damage. Your heart will not always send clear warning signals. Waiting for symptoms can mean waiting too long. The technology exists to check before disaster strikes. Use it. Take control of the factors you can influence, and make decisions based on evidence rather than assumptions.